Fecal incontinence is a loss of fecal material, involuntary loss of fecal material that is bothersome to a person's daily living. Fecal incontinence is a common problem that affects many women in this country and in the world. The majority of them go untreated, mostly because they are embarrassed to talk to their physicians about the problem, and they just deal with it themselves, and the problem never gets solved. There are multiple causes of fecal incontinence. Some of the causes are directly related to the sphincteric mechanism that is supposed to keep the fecal material in place and not to be released until the time of defecation. And there are also different types of fecal incontinence where the patient cannot hold their bowels in time to arrive to the toilet. There are many risk factors for fecal incontinence. One of the common risk factors is a difficult childbirth. There are also different types of bowel diseases that can cause loss of fecal control. For the treatments of fecal incontinence, some can be as simple as different medications and changing the patient's dietary habits. Some of them are more complex, involving surgical reconstruction of the pelvic floor and sphincteric mechanisms. And also some treatments for the fecal incontinence involve a stimulation of the nerves by different types of nerve stimulators that can be implanted to assist in the control of the bowel function. When patients get treated for fecal incontinence, the recovery process is very dependent upon the type of treatment. The surgical reconstructions tend to be a little bit more lengthy recovery, lasting 2 to 3 weeks usually. The patients treated by nerve stimulation usually recover quickly, with normal function returning the day after the procedures.